OsteoBites is a weekly osteosarcoma webinar and podcast presented by MIB agents. This week, we're talking with Simon Holland, co-founder of Elly Health, about audio companionship for osteosarcoma families. Our panelists are Maeve Smart, Osteo Warrior and MIB Agents Junior Board Member, and Lauren Raymer, Osteo Warrior and MIB Agents Junior Board Member, and Liz Vallejo, MIB Agents Program Chief. I'm your host, Anne Graham, President of MIB Agents. It's time for OsteoBites, and I hope you brought your snacks. I brought my mini Reese's and some really cool guests too. Simon Holland, the co-founder of Elly Health, is here to talk to us today about how Elly can help support osteosarcoma patients. Lauren and Maeve are joining us too. They are Osteo Warriors and MIB Agents Junior Board Members. My name is Anne Graham, and I'm an Osteo Warrior as well. I'm an osteosarcoma survivor. I founded MIB Agents to make it better for kids with osteosarcoma. Our mission is to provide direct patient and family support, to bring together the physician, researcher, and patient community in the spirit of collaboration, and by funding meaningful osteosarcoma-specific research. Simon, Lauren, and Maeve are all about making it better too, which is why they're here. Simon, would you get us started by introducing yourself, please?
Awesome, yes. So my name is Simon Holland. I am the co-founder of Elly Health, which I'm super excited to talk to you guys a bit about today. And I'll, when I present today, I'll also talk a little bit about, I guess, my history and what led me to, I guess, co-found Elly.
I'm Maeve. I'm a two-time osteosarcoma survivor, diagnosed in 2011 and 2014. I'm now 6 years, no evidence of disease. I go to Northeastern University in Boston, and I'm a member of the junior board at MIB Agents.
I'm Lauren. I am also a two-time osteosarcoma survivor. I was first diagnosed in 2017, and it ended up having a recurrence in 2018, and then also my brother was a survivor. He had it in 2011, and I'm going to be attending Capital University for nursing in the fall. And I'm a member of the junior board.
I'm Liz Vallejo, and I am MIB Programs Chief, so I help run all the various programs that MIB offers. And I am here with my wasabi almonds as my little OsteoBite snack. And my son Ian had osteosarcoma and was diagnosed in 2015.
Fantastic. Okay, well, thanks so much for having me today. Really love everything that MIB Agents does. I obviously attended the conference before all these crazy times started, which seemed like a very different world to the world that it is today. So today I'm just going to talk a bit about, how what we've created, companionship can really, I guess, help people, during these anxious times and specifically oncology patients. So what I'm going to do is I'm going to start with a bit of my background, I guess, and kind of the journey that I went through and what led me here today. My background's always been in tech. I guess I went to college. I actually dropped out of college, which I probably don't recommend, but I dropped out of college when I was there, and I really always wanted to, I guess, do something that made it, do something that wasn't the conventional, kind of route. I really want to realize that, through entrepreneurship, you can actually make a difference to people's lives. And I really enjoyed that idea of being able to create something from nothing that actually has an impact. So before Elly, which I'm going to talk to you all about in detail today, I actually co-founded a company called HotDoc. The name is very strange, but it's basically a company which is a patient engagement platform for patients and family physicians in Australia. So it basically allows, a nice way that patients can connect with their doctors. And that company is, it started nothing with my two other business partners, and then that kind of ended up, now we're servicing 5 million patients, and we did like 2 million COVID screenings, which is pretty amazing. Also co-founded a company called Vivi, which essentially is a screen mirroring solution for education. I'm sure people that are probably, have been to school recently, I'm not sure if you've got screens in your classrooms, but basically what we essentially do is we allow teachers to wireless present content to screens in the room. And that's in about 25,000 classrooms. So really, got a good understanding of education, and of as the health space. But then about 2 years ago, I kind of got a bit burnt out and thought I was kind of sick and went to the doctor, and the doctor was like, "You're okay, you're just really stressed." So I decided that I really need to focus on doing something with a more positive impact. And I guess that's when I met my business partner, Nick. Nick's the other co-founder of Elly. He was a radiation oncologist actually in Australia, and he realized when he was a radiation oncologist that he really wanted to be able to help people at a kind of larger, scale. So he actually co-founded CancerAid, which is actually the #1 cancer app in the world, and really experienced what it was like, kind of, I guess building something for patients and then working, I guess, with health systems here in the US. So really fantastic. So the two of us kind of came together to create Elly. So just before I kind of go into, what Elly is all about, just want to talk a bit about, this current time. I'm sure everybody, regardless of whether, the person's living with cancer or not, I guess it's been a really tough time. Very anxious. Obviously, everything's changed in the world. It's something that's impacted the entire world. And, it's meant that, I guess cancer patients typically have, they've got weakened immune systems. So, they are 3 to 4 times have higher risk of actually having to go to, mechanical ventilators and ICU admissions because of their condition. I'm not sure about the data specifically on osteosarcoma, but, it's definitely a very anxious time, I guess, but it does obviously impact people who are kind of an elder population. And also, I guess one of the really big things other than that is, I guess, the whole social distancing measure. I'm sure, as an oncology patient, I'm sure, you can, talk better about this than me, but, the whole idea of not being able to be around other people is kind of hard, and having the whole kind of social distancing where you kind of have to be quite isolated, especially because, autoimmune system is not quite as strong as maybe other people. So I guess, this is actually, so we obviously started Elly a while ago. We started in 2019, but then I guess it became really, impactful now, especially with COVID-19. So I just want to talk a bit about the kind of oncology patient journey and these challenges. And I'm sure these are challenges that everybody's had with osteosarcoma and any cancer patient, that when you're newly diagnosed, you feel very anxious, you feel very overwhelmed. I guess you've got, physicians and nurses that are working, to support you, but I guess, there's only a certain level of support and face-to-face they can provide. I guess you have family members, who are really trying to support you as much as possible, obviously, but, maybe they haven't been through the experience that you're going through, so it's kind of hard for them to relay certain information. I guess when patients are on treatment, there's a lot of side effects, changes in appearance, and especially, I guess, financial toxicity is a big one. Because I guess people can't work and it's slightly tougher. And I'm sure that's the feeling for families that have got, family members that do have osteosarcoma. It's one of those things that they have to probably give up working as much. So there's that whole kind of financial toxicity, which creates a lot of stress. And then survivorship, which is, also, there's a level of feeling of loneliness. There's obviously that fear of recurrence and the whole idea of the new normal, that life has really changed. And I guess, we kind of identified all of this and we thought, okay, well, how can we kind of help patients through this journey? How can we, really support them in a way that's actually scalable? And obviously there's tools out there that provide human intervention, human coaching, but we thought, how can we kind of leverage our kind of skills and really create something that, can provide that level of companionship in a really scalable way? So what we really, I guess, started focusing on how can patients participate more in their own health? That's really, really important. So for patients to be able to participate more in their own health, they have better health outcomes. So there's actually this study that was done from Oregon University, which is really interesting, where they created this tool called the patient activation measure. And this is a tool where basically patients are kind of categorized into 4 levels. Level 1 being disengaged and overwhelmed, where it's basically somebody's like, look, I'm not the advocate of my own health. It's up to they believe that they're the doctor and that their care team are the ones that are basically, going to help them get better. Then I guess level 2, which is people that are becoming a bit aware of the fact that, their lifestyle really impacts, their outcomes. But I guess, they're still very much struggling. And then I guess the third level is basically, the whole idea about taking action and taking control. Look, this is my health. I'm going to be proactive about it. And I'm going to do what I personally can to kind of improve my health outcomes. And then I guess you have level 4, which is basically the whole idea about maintaining behavior. And when you believe that you are the sole advocate of your own health. And I guess there's been a lot of studies that show that people change their mentality and their mindset, and it's actually improved significantly, I guess, health outcomes. And it's also reduced, I guess, impact on the health system, and, it provides general cost savings as well. So this is that tool called the patient activation measure that's starting to be used now for more and more studies. So we really wanted to take advantage, and I guess we wanted to create a tool that was, for, I guess, people that, that did have that kind of loneliness, that anxiety, and really, I guess, were open to actually understanding they could actually become more advocates of their own health. So what we decided to do is we decided to look at, okay, what are the different ways that we can guess, really make an impact? And we believe that storytelling is a really powerful mechanism, and doing that through audio. I mean, whenever you have a conversation with somebody, it's through audio, you're talking to somebody, and how can we create that kind of experience? So this is actually one of my favorite movies on this planet. I'm not sure if you've seen this movie before, but this is actually Her. It's basically got Joaquin Phoenix and Scarlett Johansson. Joaquin Phoenix is the main character. He's a guy in his mid-40s, and he's living in the future. And he works at this company where he basically writes love letters, essentially, which is kind of interesting. But he's not the happiest person in the world. And he writes these letters on behalf of other people. And he spends a lot of time playing computer games, and there's kind of that loneliness that he had. And then what he does is he basically downloads this audio operating system, which is basically this voice that talks to him. And that's played by Scarlett Johansson's voice. And the interesting thing about that experience is that she gets to know him over time, supports him, and really, I guess, provides him with, ways that he can basically, essentially, have ultimately, live kind of, a happier life. And we thought, wow, how can we kind of take a similar experience, but provide that to patients living with cancer? So what we've actually done is we've actually created the world's first empathetic audio companion for patients living with a chronic disease. I guess our primary focus initially is actually on cancer. But what Elly is that whole idea of the whole persona, comforting, educating, really, I guess, motivating patients to live a healthier, happier life. And that's really our goal. So we actually launched the product about a month ago, which is really exciting. So we've been kind of working, with a lot of the patients that are using the product and really making it more personalized over time. But how Elly essentially works is the primary user case of Elly is patients listen to a daily summary. Now, the daily summary is basically, I guess, a 90-second audio clip. And this audio clip is based on the patient's age group. So if they're an AYA patient or if they're an adult cancer patient. And then I guess basically it essentially understands the patient's stage. So not stages in level 1, level 2, level 3. More, are they newly diagnosed? Are they on treatment or in survivorship? So once we understand those things, then Elly provides these kind of key audio messages each day. And we cover lots of different topics. So we cover about 120 different topics on a daily basis through these kind of 90-second audio clips. Things, for example, like dealing with identity and body image, or what it's like talking to your family members, or different things like, how do you talk to other people, about, what you're going through, all the way through to things about symptom management, through to kind of, the benefits of exercise, how to deal with fatigue. So really just helping educate and motivate patients in that kind of way. Then the secondary user case, actually the sessions. So what we actually do is we work with I think it's about 16 or 17 or maybe 18 patients, basically people that have actually had cancer. And essentially what we've done is we've actually created all these different sessions in these 9 different categories. So we've actually created these sessions. For example, motivation is actually talking about like things that motivated I guess people during the time when they were going through some of their harder times, and what really motivated them, some kind of, examples of stuff they did was very much around, how they could actually, interact with other people, or, things that basically mindsets they could have to really motivate them to, kind of, I guess, live a more kind of, I guess, be more proactive about their health. Unspoken is certain things that people don't speak about, for example, like what intimacy is like, after you've been diagnosed or when you're in treatment, those kind of things that are very much unspoken. Coping is actually a new section that we created around when coronavirus basically started happening, which is all around, I guess, how to cope with really anxious times when things are very different and the world's really changed. Then we have self-care section, which is basically all about, taking care of oneself, things that people can do to really, I guess, be proactive about how they feel and taking care of themselves. Then we have exercise. So we actually work with patients that have really, I guess, since they've kind of been in survivorship, have very much been focused on how they can actually help other patients do certain exercises based on the whole idea of, the limitations that the patients have. For example, one of our patients actually worked out all these different exercises that the patients can do while they're in their hospital bed, for example, which is really, really interesting. So the whole idea is this is all coming from patients that have been through the experience, so they kind of understand and they can be empathetic. We have an amazing mindfulness teacher who actually had lymphoma, and she basically runs through mindfulness sessions. So meditation becoming from that, the world, I guess, from the perspective of a cancer patient. Then sleep story, we have sleep sessions, which is basically how you can actually, deal with street, especially when you're stressing, for example, about, everything coming up, or if you're stressing about an upcoming treatment or appointment, really dealing with that. And then things like nutrition and symptoms, which are very much also really relevant. But this is all from the perspective of being an actual cancer patient, which is really exciting. So yeah, these sessions, we're just building a library of these sessions. We actually work with a number of contributors. And on the bottom right-hand corner, you might see somebody you recognize, which is actually Lauren. So super exciting. But these are some of the other contributors we work with. As you can see, a really diverse, broad mix of different, types of cancer. And I guess, just people just talking about experiences. For example, Alex is the person I mentioned before who does the mindfulness sessions. And then you have, for example, there's a big variety. For example, Angelo is actually a caregiver, so he actually has been speaking about it from a caregiver's perspective, which has been really, really exciting. Ash is actually very she's one of our newest contributors, and Ash actually she opened up a bit about everything that's going on right now with the whole, I guess, as I'm sure you're all aware, it's been quite a tough time, and it's been a very, I guess, opportunistic time, which is really exciting about, this whole movement towards Black Lives Matter. And she really spoke about her journey as a breast cancer patient, and when she did have breast cancer, how it actually impacted her, and it was really, really, really hard. But the hardest thing that she had to go through was seeing her children experience racism at school, and she said that was harder than any type of cancer treatment that I've ever had, and that was harder than anything. So just kind of really just being able to just kind of talk about that really openly was really amazing of Asha. But really, really, really amazing people. Emily, for example, hugely into fitness, had ovarian cancer, and is really focused on basically helping patients be proactive about exercise, which is really exciting. So, some really amazing people here who've got a really broad mix of experiences, and makes it really, really, I guess, the content really, really compelling and extremely empathetic and relatable. And let's keep going. So, so we did create specific content for COVID, obviously. These are some of the sessions that we actually created. We worked on this with actually some of the contributors, which I mentioned. I guess, we really try to, I guess, create content that's really relevant to a patient that's going through these times. I mean, the whole idea about social connection, or what happens when you are hearing all about this overwhelming news, you're hearing about all these deaths, and you're hearing all these hospitalizations, how to kind of deal with these kind of things to kind of take your mind off it, ways to boost your immunity, coping mechanisms. So that's where we really think that we've got a really good tool here for, I guess, dealing with these times specifically. And then that's why we've had a lot of success with health systems. So there's actually a number of health systems that we're working with, which is super exciting. For example, I don't know if I can mention them right now because it's going to go publicly, but I'm sure you're going to see it all soon. But very, very exciting, some of the work that we're doing, and you're going to slowly start seeing this kind of and more health systems over time, which is really exciting. But I guess really what's important to understand is us as a company, our mission is for Elly to become part of the standard care journey for every patient. Imagine every single patient that basically, is diagnosed, then starts receiving treatment, that they actually get provided with Elly to kind of provide them with that additional support that's required. So with MIB, we're obviously, super excited to be, working together and super supportive of what, MIB agents are doing. And that's why we'd love to be able to offer every single MIB agent lifetime access to Elly for free. Very simple to get on board. Basically, all people need to do is basically just download Elly from the App Store. And then basically when they get prompted to actually, if they have a patient code, if you have a patient code, then basically enter the patient code MIB100, and that code will give you completely free access for the rest of your life. And please share this with anybody that you feel will need it, especially right now, especially with everything going on. We just feel it's our kind of part of our mission to really get it out to as many patients as possible, and not looking so much at the financial return at this point in time, but really just being able to provide this and make an impact on people's lives, which is part of the reason why we started this company. So yeah, I believe Anne will be providing a bit of a brochure which actually provides just this key information and the exact instructions that you need to follow to basically download Elly and use it. But yeah, that's, I speak very quickly, so I probably, go through things a bit quicker than most people do. But yeah, I really hope that you kind of enjoyed the presentation, and, happy to kind of, talk about any questions or anything like that.
Thank you. That's amazing to have access to this incredible tool that is a companion throughout your journey, and a very positive force in that companionship that it's providing throughout your journey with osteosarcoma. It's a harrowing journey indeed, so really cool to have guidance on that. So thank you. I think that's going to be really impactful. Thank you.
I've just been looking at online what you've got, and I notice it's available on the App Store for Apple, but not yet for Android. Are you going to cross-platform it?
Yes, we are. We just wanted to focus on Apple initially, just to really make sure that, we become indispensable to patients. But yes, absolutely, the plan is, to do an Android version. We had to pick one platform to kind of start with, but definitely I will let, I'll let Anne know as soon as we have the Android version available, and that will also work with the same code as well to have lifetime access.
Do you have a target population? Are you doing anything particularly to entice like pediatric patients?
Yeah, so I mean, we do have a whole section which is for AYA patients, so adolescent and young adult. Because of some of, I guess, like the compliance, it is for patients that are over 18. But the whole idea is that caregivers, should be able to use Elly. They should be able to actually, say they're an AYA patient, and then basically provide that kind of, I guess, content. It does become a bit tougher for pediatric patients under the age of 18. The reason for that is because there's a huge amount more compliance to do. So, we would like to look at that more in the future, but, very much obviously understanding that osteosarcoma is typically something that people have when they're under 18. Elly is very, I guess, a good tool for the caregivers. So if you're over 18, definitely download it. If not, if you're a caregiver, I definitely recommend using it. Yes.
Great presentation. It's nice to see your face again. I was at MIB Factor 2020. I know that you're interested in, looking at ways to include the under 18s. At this point, I'm working with some parents who have, teenagers with osteosarcoma. Do you think that Elly would be appropriate for parents to use with their kids at this point?
Absolutely. As long as the parent is over 18 and they're the primary user, absolutely. Mm-hmm. And we're really designing that way, So, it's I guess, with parents, especially, I guess a lot of the kind of learnings from Elly are going to be really, really, really valuable. So for them to, use it with their kids is definitely a good way to use it, and be able to share that information. And I mean, a lot of the experiences that I guess the patients are going through, their caregivers are also going through as well, as far as anxiety, the isolation, the what to do. So it is definitely very, very relevant for caregivers.
Okay. That's fantastic. I do have another question too. I really like the patient stories and the patient experiences that you've included. Will those be like osteosarcoma specific, or how does that work? It looked like there were a variety of different stories, but will they be specific to the diagnosis?
I mean, in the future, we might be looking at specific diagnoses, but as you can imagine, the amount of different types of, I guess, cancer is pretty broad. We'd love in the future to be able to start having specific ones specific to different conditions such as osteosarcoma. But for now, we've tried to really make it broadly for cancer. But also, none of our content is so specific that it kind of, entails information about a specific condition, because a lot of this stuff is actually relevant to all patients, regardless of, I guess, what type of cancer they may have. But yeah, we'd love to look in the future of maybe creating some content which is very specific to a very specific type, for example, osteosarcoma.
Fantastic. Thank you.
Yeah, we would love that too.
We can talk about that actually, Anne. We can talk about that actually. At some point, yeah.
I'll tell you one thing I would love to have. I think about it literally every day. Is because I have an app that I do exercises with every day, most every day, and half of them I can't do, so I have to think of a different exercise that I can do in that place, just because of limb salvage surgery or an amputation. And so it'd be really cool to have an exercise, somebody who is an exercise physiologist that could go, okay, if you have limb salvage surgery, here's how you adapt.
Yeah.
How you adapt this exercise. If you're an amputee, this is how you adapt this exercise. That would be amazing. Okay, we'll chat.
Yeah, no, that sounds really good actually. Yeah, definitely.
We'll chat, because those people, that exists. It exists. We just have to corral them in. Lauren, would you like to talk about your involvement with this platform? I'm super excited about you being involved in it.
Yeah. So I was actually at the MIB Factor conference this past conference, and I was able to meet Simon. We were on the same panel, and he ended up reaching out to me, and I've been able to have conference calls with some of the creators there, and it's just like a very casual a casual talk, and they're able to, I get to say my story. I get to say the little things that a lot of patients wouldn't know about. One of the things that one of the sessions that I was able to create with some help was about the ruin meal, and the idea that what you eat, right before and after your first chemo will usually end up, being a little wonky afterwards. Sometimes it's the sights, it's the smells. So it's super exciting that I get to share those kinds of things to patients that otherwise would not know that, especially, going into cancer for the first time as an osteosarcoma patient.
Yeah. So when knowing the app better than most of us who are listening today, what part do you think, like, what's the part that you're so excited about that you really wish you would have had when you were in treatment?
I think that it is super exciting that you get to hear from all of these different survivors, because most of the people on the app are either, they're in treatment or they're surviving. And it's that idea of knowing that there are that many people out there that are continuing their lives and they're living their lives normally. And it's helpful to be able to see those living proofs.
100% get what she's saying. When you're in treatment, one of the most meaningful things you can hear is, I was where you are and I survived.
I know that you had touched on COVID in your presentation, but I know when I was in treatment too, what was always most beneficial to me was like seeing people and having visitors. And since that's obviously not possible right now, has that impacted your business? Are you seeing more users signing up for the app?
Yeah, definitely. I mean, there's definitely more interest, and especially with health systems who are going to be helping us get Elly out. So hospitals are going to help us get Elly out to patients. That's been really beneficial because I guess, especially right now with, COVID, I guess, hospitals are overwhelmed. Not sure, they're having to kind of turn away patients from treatment. So I guess, that's been a really big difference. So they've been really on board about, getting on board with us and be able to provide it to the patients and kind of seeing the value in that. But that was just interesting what you kind of touched on, Maeve. I mean, I'm not sure if you're interested, but, would love to kind of speak offline if you're interested in maybe becoming a content contributor. We actually pay our content contributors as well. So, if you are interested, and if anybody here or listening to this call is maybe interested in becoming a content contributor, we'd definitely be very open to talking to you because we want as many different experiences as possible.
One of the webinar attendees gave Lauren basically a fist bump and said, "Yes, same here on the ruin meal." Her word of advice is to tell people not to eat something you really like, because you're never going to want to eat that thing again. Lauren, were you finished with what you wanted to say? We lost you, I think.
Yeah, the connection here isn't super great, but yeah, just that idea that there are other people and you're not alone. And I think that's what you want to hit home.
Yeah, that's a big thing. That's a gift we can give each other. And I know, I mean, that this has this is going to be a really brilliant thing for the osteosarcoma community. And I think having Lauren's voice on there and hopefully Maeve's voice on there to know that somebody went through this, survived it, and you're not alone. This is something that's, people have survived and gone on to thrive post treatment is really a gift to receive while you are just in the dark night of the soul, as I like to call it.
Simon, when I tend to think about empathy, I tend to think about it as a very personal, dynamic thing. Me talking to you and you truly understanding where you're at. And I love how this app can get that connection, but it be when you need it, so if it is the dark night of the soul that Anne talks about and it's 3 a.m., you can get on and you can, listen to things and that kind of stuff. But is there any thought of expanding it to where you can have those personal connections, those chats with other people that have been there, that might boost that empathy just a little more?
Yeah, definitely. And that's something that's very interesting. I mean, that's something that we want people to feel as they're part of a community and they're not alone. That's extremely important. And that's why the content is, being created by people that have gone through similar experiences. Obviously, they're never going to be the identical experience. Everybody has unique experiences. But what we thought, well, there's a lot of tools that are out there that are quite good. I mean, you've got tools like, Facebook. I'm not saying Facebook's the best tool or Facebook groups is the best tool for, having that kind of sense of community and being able to talk to one another. But, there are definitely tools out there and other kind of platforms that kind of are designed more as kind of community building. And I guess what we thought, well, should we try to kind of do community building as well and have a platform where people can talk to each other? Or should we let other people do it that might be better than us, but us really focus on what we're good at? So we wanted to feel as though there is that community, and maybe what we might start doing is allowing, patients to be able to contact some of the contributors directly and talk to them about their experiences. So there might be a social element we look at including in the future. Becoming a full-on kind of social network or community is probably a little bit different to kind of what we're trying to provide, but I totally get what you're saying. I mean, and what we're also looking at doing as well is having patients that use Elly potentially being able to kind of ask what kind of questions is going through their mind, and then allowing us to create that kind of content for everybody to use, if that makes sense. So we are trying to kind of really get patients more involved. I hope that kind of answers your question.
It does. Thank you. I appreciate that. I like the idea of if there's a question, they can put it out there and then you can have your content people, add on and really reinforce what's coming out of the people in need. I love that.
Awesome.
Yeah, really cool. Janet, did you have another question?
So, I actually downloaded it while you were talking. And as I kind of look through the themes, I see, a lot of overlapping needs in other health communities as well. So I was wondering if Elly can be adapted to other conditions like diabetes, for example, or vascular disease, as people are, struggling with support, and especially in rural areas.
Absolutely. Now, Jenna, that's a really, really good question, and very timely, I guess. We decided to focus on one condition initially, being oncology, and really we wanted to get that right, and we wanted to get it really right. But there's definitely been a lot of demand from patients and also physicians saying, look, why isn't this relevant to other different conditions? So as a company, we really want to be able to focus on the underserviced conditions as well. So obviously we want to go for cancer, but we are looking at things like MS. We are looking at heart failure, lung disease, different conditions that are kind of more underserviced. But yes, definitely it is applicable to different conditions. I guess one of the big things with Elly is that for it to be really impactful, it's about us really finding a community of I guess, contributors that have actually gone through that condition. Because maybe, for example, you might have, MS, for example, but you're hearing from a patient that has cancer, it might not be as applicable to you. So we do want to add more conditions, but when we do add a condition, we want to make sure we have a strong community of contributors that actually have been through that specific experience to contribute the content. So we're definitely going to be adding more over time. But it really does take quite a lot of work and effort for us to really adapt it for different conditions, which we plan on doing once we feel we've got cancer really right.
It's a tough thing to get right, but you're well on your way. You've covered so many aspects that really need addressing for cancer patients everywhere, and up to and including. I mean, I think this, given that our specific cancer is a pediatric and AYA, adolescent young adult cancer, this is really going to be helpful for the patient family and certainly the caregiver to have this support as well. Because for one thing, we all know, having gone through it on the panel, is one person gets the cancer, but the whole family has the cancer, and everybody has to deal with the cancer in a very real and very impactful way. So I think this app will actually be helpful for the family to, have the mindfulness and the moment every day to kind of have a quiet place and connect with something outside of the space that they're in and the reality that they're in. Any questions?
I think what markets available in the US, or what markets is available in? I think that was from Liz.
Oh, you know what? That's a good question, because I actually had this question asked of me about this presentation, about this app. Can somebody access it from another country? And if so, which countries?
Yes, so it is available in quite a few different countries. It is available in the US, it's available in Canada, it's available in Australia, it's available in New Zealand, it's available in kind of a fair few other countries around the world. It's predominantly Europe is the one area. The UK and Europe is not available, just because we have to deal with their kind of GDPR policies, so their privacy policies. But we're working on that now and hoping to make it available in those other in Europe and the UK. But yeah, available in most other countries at the moment. And we're also looking at other languages as well, which is very exciting. The thing about finding a good voice is harder. It's quite hard because, it needs to be a voice that people feel they can relate to. And I guess, there's also not just things like us just translating what we have now for other countries, because you have to understand the cultural differences in different countries. So that's really important to understand. So, for example, we want to create a Spanish version for people that live in the United States that are Spanish speakers. So that's probably something we're looking at. But, there definitely has been, we've been asked for other countries as well. But I think it's really about being able to kind of identify, what's important culturally to them, as well as actual translation as well. But yeah, so it's available in most of the world other than the UK and Europe for now.
To have innovation around the patient and patient care is just, it's so important, and it's so brilliant, and we can't wait to start using it, and to have the community start using it, and giving that feedback and making it better, Simon. It's making it better. So, okay. So really cool. Thanks very much for that. Look at us, like right on time here, like amazing. Great session today. Cancer Survivor Month. And we have a fabulous t-shirt that Lauren can model for us. There it is, looking swanky. I have one right here too. For Cancer Survivor Month, if you would like to send a swanky MIB t-shirt, which, by the way, is the softest t-shirt known to man. Am I right? Yeah. It's so much the best t-shirt. It is free when you donate $100 or more to MIB agents via our website, and we'll send it to anyone you wish us to send it to in honor of Cancer Survivor Month. Also wanted to tell you that this video and podcast is available on our website on the OsteoBites section, blue bar at the top of the MIBagents.org website. So you can access this via podcast, YouTube, etc. We'll be coming out with that in the next couple of days. And let's see, I guess that's it. Thanks for joining us today. And of course, thanks to our guest, Simon Holland of Elly Health, and Maeve, Lauren, and Liz. Thank you very much for being here. Thanks for everybody who joined in and asked great questions. Stay safe, everyone. If MIB agents can be of help to you, please let us know. Together, we make it better for osteosarcoma kids everywhere. Register now for next week's OsteoBites, when Christina Iptoma of MIB Agents and Dr. Alana Church of Dana-Farber and Harvard Medical talk with us about the MIB Agents Testing and Research Directory, a guide to testing and research options to either help inform a personal treatment plan and or contribute to general osteosarcoma research. Sign up on our YouTube channel for the Library of OsteoBites or listen to OsteoBites wherever you get your podcasts. Until then, please help make it better for kids with osteosarcoma. Visit our website at mibagents.org.